Can strep throat be mistaken for the flu? Imagine waking up with a sore throat and feeling a bit feverish. It might be the flu or it could be strep throat. Both can cause similar early symptoms, which can make telling them apart tricky. Strep throat is caused by bacteria called group A streptococcus. It usually hits suddenly with a very sore, painful throat, making swallowing uncomfortable. You might notice red and swollen tonsils, sometimes with white patches or streaks of pus. Swollen lymph nodes in the neck are common, and you might see small red spots on the roof of your mouth. Interestingly, strep throat rarely causes cough or nasal congestion, which are more typical of colds and the flu. The flu, caused by influenza viruses, often starts quickly with fever, chills, body aches, and fatigue. It usually involves more than just the throat. People often experience cough, nasal congestion, headaches, and sometimes gastrointestinal symptoms like nausea or diarrhea. And like strep throat, the flu tends to make you feel exhausted and achy all over, not just in your throat. Because both illnesses share symptoms like sore throat and fever, it's easy to mistake one for the other, especially early on. If you have a cough or runny nose, it's more likely to be the flu. But if your main problem is a very painful sore throat, swollen tonsils, and no cough, strep might be the cause. Getting an accurate diagnosis is important. Strep throat needs antibiotics to prevent complications like rheumatic fever. The flu is usually managed with supportive care, such as rest, fluids, and sometimes antiviral medications if caught early. Doctors can perform quick tests like a throat swab for strep or a flu test to confirm what you have. From the perspective of influenza, understanding these differences helps prevent unnecessary antibiotic use and ensures you get the right treatment. Remember, each person's experience can vary, so it's always best to see a healthcare professional for proper testing and advice. In summary, yes, strep throat can be mistaken for the flu because they share symptoms like sore throat and fever. But paying close attention to other signs, such as cough, nasal symptoms, and the appearance of the throat, can help distinguish them. Always seek medical guidance to get an accurate diagnosis and appropriate treatment.